Innovation distinguishes between a leader and a follower. Hello, everyone, and welcome to Nerdy Optometrist. This is your host, Ukti Vora. The quote I just mentioned was said by Steve Jobs, and I have a guest for today who really defines what a leader is. Mr. Raghu Gullapalli is the Chief Product Officer for the pipeline of product and solutions being created at the LV Prasad Eye Institute Center for Innovation. He also actively mentors the founder of startups being incubated at the LV Prasad Eye Institute and evangelizes the product they create. Prior to joining LV Prasad Eye Institute, Mr. Raghu was a venture capitalist, making investments rooted in deep science such as healthcare, life sciences, artificial intelligence, Eyetech, robotics, and the tactile internet. Before his career in venture capital, he worked in product development with Apple, Adidas, and DARPA. I'm really excited to have such an amazing leader and a visionary to be part of this podcast. A warm welcome, Mr. Raghu. It's a pleasure to have you on this podcast.
Oh, thank you. And please just call me Raghu. Thank you.
All right, wonderful. So, Raghu, I'm sure I have just given a blurb of your achievements and your journey so far, but I would like to learn a little more in depth if you could share your journey in eye care, specifically, if you would like to talk a little more on that.
My journey in eye care started over a decade ago, actually. So, about in 2007, 2008, when the world financial crisis was happening, I was working with the Institute for Eye Research, which was a subsidiary of the Brian Holden Vision Institute. And we were
Mm-hmm.
developing solutions in terms of new age intraocular lenses or extreme depth of focus lenses and things of that nature. And beyond that, I maybe more recently, I was doing a lot of product advisor as more of a product advisory role with LV Prasad Eye Institute. Um, I started doing that around 2014, 15. And
Mm-hmm.
when my wife and I were planning on moving overseas, Dr. Rao, who's the chairman at LV Prasad Eye Institute, and his vice chairman, Mr. Rahman, convinced me and my wife to perhaps move to Hyderabad and to take on the role of head of product for the group.
Wonderful. So I do know many of us do know about the Innovation Center, but how did it all begin? If you could just share a little more on the history behind it and what was the trigger that led to this Innovation Center?
I would say the big thing for us was LV Prasad Eye Institute has been doing research for since pretty much since inception at 32 years
Right.
ago, and we spend generally about just a little under 15% of annual revenues on research. And I
Mm-hmm.
think about a decade ago, Dr. Rao, our chairman, said, "Okay, you know what? Research is all well and good, but we should take it the full circle and do research and development." And many academic research centers like LV Prasad Eye Institute only do the research, but they don't actually do the translational element. And
Right.
at that point in time, that's when the translation some became more and more important to us. So,
Mm-hmm.
and then in 2012, 13, uh, Dr. Ramesh Raskar, a professor at the MIT Media Lab, was
Mm-hmm.
uh, was in conversations with Dr. Virendra Sangwan, one of our eminent ophthalmologists at the time, and in the conversation they said, why isn't there a great innovations or hackathons or things of that nature emerging from the Indian landscape, especially in organizations like LVP? And out of
Right.
that, they basically in 2013 we hosted the first Engineering the Eye hackathon, and
Mm-hmm.
out of that immense, tremendous response, what Dr. Rao saw and other people saw within the organization, they said, okay, maybe this is something worth investing in as a long-term solution. And we were very fortunate that one of our trustees decided to back it, and he decided to do it as an anonymous donation. He did not want his name on the innovation center per se, which is a tremendous
Yeah.
gesture on his part. And
Right.
fast forward now, we have 135 products which have been developed in our network, in our system, and have been evangelized and shared within our network and around the world.
That's wonderful. I do know some of your products which are amazing, and we're going to get into that a little later. But to talk about the hackathon, I think that's really interesting. Just to dig in a little more, has that been only for engineers, or do you have any hackathons for optometrists or ophthalmologists as well?
So actually a very important thing to say. So the Engineering the Eye Hackathon and the series around it are for we have ones for designers, we have some for optical engineers, optometrists, etc. Even the Engineering the Eye, the core hackathon, is actually not only for engineers. The idea is to work
Right.
in a multidisciplinary team to create solutions which deliver impact. The thing is,
Absolutely.
many of the engineering students who participate in the hackathons do not have the domain expertise to actually create anything particularly impactful in such a short period of time. But
Right.
pairing them with an optometrist or ophthalmologist and other kind of specialists in that regard allows for that rapid advancement of the projects within during the course of the 5 day hackathon.
Wonderful. And when is it usually, is it like a fixed time in the year when you have the hackathon? If you like to, share it on this podcast for all the listeners.
Yes, we've had it for 8 years now running. We've had it. Last year was we didn't really have the hackathon per se. We had a design workshop, design thinking workshop, which during the Hyderabad Design Week. Generally speaking, what we do is we invite students and actually young employees across the landscape of the Indian ecosystem as well as worldwide, for that matter, to
Nice.
participate. And we share the problem statements a couple of weeks in advance, so people can kind of think on what they're trying to solve for. And then there
Mhm.
afterwards, at the hackathon itself, we introduced them to the ophthalmologist or the optometrist or vision scientist who provided the problem statements, and for them to delve
Mhm.
into and really ask deeper questions about what
Right.
the pain points those clinicians were facing.
I think hackathon, I actually had just been part of one of the hackathon for COVID, which was held by MIT. And I think being part of hackathon, even as a learning experience for all optometrists, ophthalmologists, or any listeners for this podcast, I think it's a wonderful experience. Do look out for this and do participate. Thank you so much for sharing and initiating this. I would like to really thank LV Prasad for instilling this kind of project. Now, I do understand that this innovation and putting the idea into real practice takes a lot of background work behind it. But if you had to highlight major hurdles or limitations when it came to putting these ideas into reality when you started this innovation and during your journey of leadership, can you share a little more on that?
Well, I think a lot of it is understanding user behavior. I think at the very core of product development is really understanding the pain points for the users. The
Mhm.
unfortunate reality is that many times in the medtech ecosystem, and in terms of startups as well as many of the founders fall in love with their solution and then try to seek a problem to basically match it with. And we try to take a completely opposite approach where we try to find a problem to fall in love with. And then we say, okay, what are the solutions or possible alternative, the creations, something we can create which can solve this problem and this solve for this pain point. And that is an exercise in practice, which is very hard to manage because unfortunate reality is many people in the education system, whether it be in the United States or in India, are not necessarily taught to think that way. Is where in
Right.
terms of thinking of it from a problems first perspective rather than a solution first perspective. And
Right.
so, in many ways, we have to kind of retrain or recalibrate a lot of our engineers and developers' minds to think about it from that perspective. Think about the problem, ask the people who are seeking the solutions for exactly what the pain points are. Are these needs versus wants? Are they real problems or are they just something with a desire, which is a simple tweak on existing solutions? Um,
Right.
because the thing is, what we really don't want to do is be a copycat organization and things of that nature. We'd like to work in white spaces, work on things which very few other people or literally nobody else is working on. And that's where we
Mhm.
feel like we can add the most value. If we're simply
Right.
doing copycats, there's no accretive value for the larger ecosystem in any way, shape, or form.
Absolutely. So this led to me asking you another question. Do you have some training modules or workshops to, change this mentality for people to think of, instead of looking solution first, look at the problem and, then come to the solution. Do LV Prasad or have some workshop training for this kind of thinking?
Yes, actually. So, as I mentioned, actually, I don't know if I mentioned this earlier. So we have a lot of training modules or education as a big component of our organization, our parent organization, LV Prasad Eye Institute.
Mm-hmm.
And we take some of those training modules and apply it and provide that information to a lot of our engineers as well. So all of our engineers and developers have to go through a vision technician training course
Mm-hmm.
so that they are quite well versed or reasonably well versed with ophthalmology terms and terminology so that when they converse with optometrists, ophthalmologists, vision scientists, etc., that they're conversant in their ontology so
Right.
that it's well understood and that there's nothing lost in translation. That's one part of it. And
Absolutely.
and then beyond that is what we've done is, for example, with these new systems like artificial intelligence and things of that nature, is it's all about data. It's all about labeling data and things of that nature and understanding how good data is created. And
Right.
all of our optometrists and ophthalmologists who work directly with the Innovation Center are actively encouraged to go through understanding how AI for product management or product development works. And in terms of
Mm-hmm.
actual labeling data, putting data in an appropriate fashion, which is good data from the get go. And these are things which
Right.
allow for now a cohesive unit to be created where both the developers and the engineers and the clinical experts are aligned in their thinking in the sense that they both feel like they've contributed to the process rather than it be something where the doctors or clinicians are providing what we call in Hindi gyan or knowledge without any kind of extra value beyond that.
I think this overlap and collaboration of understanding each other's language really makes the entire process much more meaningful. Because even from a doctor perspective, whether it's an optometrist or an ophthalmologist, it's important what can be done, because sometimes you might not have the vision of what are the possibilities with technology. So if you are trained, or if you have a little more idea of how it works, you can definitely create more value to the process. Now, I also know, talking about the highlight of the current situation, COVID 19, I do know a lot has been done at LV Prasad Eye Institute by, providing protective gears and things. How do you see, apart from, things changing in the future, how do you feel the eye care practice overall is going to be affected now that things are gradually getting better in few areas versus other?
So I think one of the interesting elements which you're seeing is an acceleration of certain trends, like telemedicine or teleophthalmology specifically in this case. So
Right,
when you're trying to bring about a new product or new solution into a market, one of the big challenges is bringing about a behavioral change and addressing the inhibitors for that behavioral change to happen.
right,
Obviously, with the COVID pandemic, which we're now facing, some of those inhibitors have been tempered
right.
in many ways. Is like so more governments are more open, hence the regulations or regulatory requirements have been lessened, etc. So the path to acceleration or path to pushing these products or solutions into the markets is faster, as well as the amount of pushback from the existing clinicians versus these system towards these systems is also minimized as well because they're like, okay, they feel the need to embrace them, otherwise their practices and their patients will suffer.
Absolutely.
So I think that's the opportunity. And additionally, what we're looking at is just really trying to look at it from a first principles perspective. So the idea of first principles is how do we break down things to its constituent layers. So we look at the entire patient journey, which
Mhm.
exists in a normal ophthalmology practice or optometry practice, and try to understand where technology or innovative solutions can find a role or fill a gap in a home care environment. And now, for
Mhm.
example, cataract surgery
Right,
is the most commonly done surgery in the world. And the unfortunate reality is post
right.
surgical interventions or post surgical adherence in care is very, very challenging at this time. So, what we try to do is address that by creating
Mhm.
solutions which allow or using existing solutions we have for alternative problems and applying them in these use cases. So one of the
Mhm.
big problems for people who have cataract surgery is just having their refractive error measured to see whether the intraocular lens has been set right or not.
Right,
And one of the existing solutions the LVP has had for several years now is something called the folding phoropter,
right.
which is a device for allows us to quantify the refractive error of patients. Now we're able to use this as a binary mechanism to see whether the patient's vision is improving or not on a week-to-week basis, so that if they feel there's any error or any issues they might have, they can address that through a telemedicine consult. They can show the progression, or and they're like and the doctors feel like when they have relevant information, they're able to give constructive feedback to the patient.
Absolutely. Now, talking about the innovations and things that you have developed at the Innovation Center, one, you just mentioned about the folding phoropter, but I do know you have a lot in the bag. If you could just highlight couple of products that have been, top of the list, which has really helped, not just now, but is going to be the future, if you would like to talk a little more on those things.
So, as I mentioned earlier, Ukti, I think one of the things which we really focused on is creating a holistic vision for view of healthcare as a whole,
Mm-hmm.
and looking at that entire patient journey as well as the clinician experience. So, off the top of my head, what we've created is a that holistic view. So the holistic package starts with what we call our system of intelligence, Bifrost. So those of you who are Marvel comic
Mm-hmm.
fans might be familiar with the Bifrost, which is a bridge between Earth and the heavens. In this case,
Right.
Bifrost is a bridge mechanism which connects EMR systems like our iSmart EMR, LV Prasad Eye Institute, or any other EMR like NextGen or Epic, etc., with the diagnostic
Mm-hmm.
device in question. So the diagnostic device will essentially push raw data down into the Bifrost layer, where it is will be formatted and distilled into a structured format to be used at a later date, so that it'll be provide true predictive value. Additionally, this Bifrost layer also basically interacts with various software systems, so that if, say, a developer, like say you, okay, want to develop a solution for, say, visual acuity or
Yeah.
attention or things of that nature, areas of interest for many optometrists, now they can create this app on sitting on top of the Bifrost layer. So the Bifrost layer is not just the system of intelligence; it's also a system of engagement, which allows for the rapid development and rapid prototyping of solutions in ophthalmology. And this allows, and on top, and for layman's terms, Bifrost in many ways is our Google Cloud. So just like in Google Cloud, you have Google Maps, you have Gmail, you have a variety of applications resting on top of that layer. Similarly, in this case, on top of Bifrost, we have a various
Mm-hmm.
numerous number of applications which we've created or partners have created, which rest on top of Bifrost.
I do know that one of Ohm is one of the thing which kind of works on Bifrost. If correct me if I'm wrong.
That is correct. Yes.
That has been awarded as well as an innovation.
Yes, yes. I mean, like, we're very, very happy, pleased with the results. NASCOM, which is a local large technology alliance here in India of the major technology companies, awarded the Tech for Good for Healthcare award to the OM project. So
Right.
OM stands for Order of Magnitude.
Mm-hmm.
It is a solution which our team, led by Juhi Bhaskar, one of our product engineers, developed. And what it does is basically quantifies the visual field of patients, as well as quantifies any other anterior problems of the eye. So it's a dual purpose solution, which we hope will be have widespread positive results for our patients and our doctors.
Absolutely. I actually had a glimpse of it and it was amazing just to see the video how it works. So for anyone who have not checked it out, please go ahead and check out the Om product from LV Prasad Eye Institute Innovation Center. Now, I do know that we're talking about, the innovations thing happening at LV Prasad Eye Institute. But I do know many students or optometrists are still struggling on how they can contribute or help. And we did talk about this offline as well, that there is a gap or limitation how optometrists perceive and the contribution that they can do to this innovation. Can you share a little more insights on how you see these optometrists can contribute for all these innovation?
So I think LV Prasad Eye Institute in many ways is a rather unique organization in the sense that we really value the input of optometrists in the entire clinical workflow, in a very significant fashion. We have about 80 optometrists on our staff. In addition to that, we have another 15 vision scientists and a number of students who are pursuing their PhDs at our organization at the same time.
Hmm.
And because of that value we have, which we feel for the optometry community, we think it is our belief and our contention that optometrists actually, in many of the organizations across the world, don't provide or do not push for the optometrists to be ambitious enough.
Right.
For example, it is our contention as technology advances, optometrists will be doing a lot more of the work which traditional ophthalmologists currently conduct in their practices.
Mm-hmm.
So most of the outpatient procedures right now, with the effect, are not handled by optometrists in most practices. Where in terms of capturing refractive error, capturing visual acuity, confrontational visual fields, slit lamp examination beyond a point, posterior image analysis, any of those elements, or always even OCTs, etc.
Right.
These are things which are considered the sole province of the ophthalmologist. But the
Mm-hmm.
reality is, the ophthalmologist has a larger role to play, and his or her larger role is on performing those higher level interventions for the patients, i.e., the cataract, the surgeries, or the laser treatments, etc.
Right.
And given the significant burden of disease we have in the world, and in eye care specifically, the role of the optometrist is going to become more and more important. Now,
Right.
these optometrists using these kind of semi-automated or automated systems will be providing more of the empathy, more of the skill, providing the direct relationships with the patient,
Mm-hmm.
more so than the ophthalmologist in time.
Right.
So, for example, for all the talk about, say, posterior fundus artificial intelligence systems,
Mm-hmm.
well, the thing is, who will actually be deploying those or using those in the network or any kind of healthcare ecosystem? It's very likely it'll be the optometrist actually doing that as well.
Right.
And I think that is something where optometrists can really say, hey, you know what? We're providing far greater value than just refractive error and visual acuity checks.
Absolutely. Yeah, I absolutely agree that optometrists as a community overall, we need to push and start looking at how can we contribute to be part of these important innovations and work on the diagnostic part, and even that would eventually help taking away a little burden from the ophthalmologist what they have currently with the amount of widespread disease that you rightly mentioned.
Ukti, one thing I would like to mention is our research organization is actually named after an optometrist and vision scientist, Dr. Brian Holden.
Right.
Just to put it in perspective, is Dr. Holden was a prominent optometrist, but he considered himself a public health specialist first and foremost.
Right.
And that kind of thinking is also very important for optometry, in the sense that optometrists are at frontline workers for public health,
Right.
and it is something which very few of them actually consider themselves as so. One of your former guests, Dr. Kovinaidu,
Right.
is a public health specialist
Right.
in many ways, and an optometrist as well.
Right.
So I think these are the different ways which optometrists can look to expand their horizons as well.
Absolutely. It's about looking how you portray yourself, whether it could be brand holder, whether it's Covenaido, whether it's any optometrist. If you take a lead and understand the kind of impact you can have in people's life, you can definitely do much more than just refraction or being an assistant who is doing other primary tests. You definitely are the primary care practitioner. I think that's how an optometrist should look at these things. Before we end this podcast, I would like to ask you a final takeaway message, specifically, based on your experience, if you would like to share.
I think one of the things which I probably again to go back to in my original comments were really find a problem which is really significant and really fall in love with that problem. The thing is, the solutions for that problem will evolve over time as technology evolves, as different things are created. But the thing is, the problem itself, unless you're creating a significant cure for disease or error intervention at birth or things of that nature, I
Right.
don't think that problem will persist. So I think that is something which you can build your career around in many ways. And a lot of people don't take that long view on it. The ophthalmologists, ironically, in our institute, have taken a long view on it and basically become super hyper specialized. And they take a 10, 20, 50-year horizon on these various conditions. For many of your listeners, I would encourage them to take that
Mm-hmm.
same view on it and simply say, okay, if say the problem is something of refractive error or vision science, is it myopia? Is it dry eye disease? Is it any of these other conditions which are actually within the significant wheelhouse of an optometrist or vision scientist? Now, can you go deep in those subjects and create solutions accordingly? and try to identify partners who can advance your problem solving.
Absolutely. I think looking at a problem, I think, is a fantastic takeaway. And I'm sure whoever is listening to this will start digging more into it and start, broadening their perspective. Thank you so much. I think this has been a wonderful podcast and a session of learning how innovation, along with eye care specialists, can change the future moving forward. For all the listeners who have joined and listened to this podcast, please do subscribe so you do not miss out on any of the updates. Thank you so much, Mr. Raghu, for being part of this podcast. I really appreciate your insights.
Oh, thank you so much for having me. It was a wonderful time.